outline about the hormone thyroid release, and it is called the which is called the thyroid pituitary axis. This show the thyroid hormone, and other thing is it shows the pituitary gland, and the other thing is hypothalamus. This is called the thyroid axis, and when there is a lacking of thyroid hormone in the peripheral tissues, then it can stimulate the thyroid TSH. Basically, this message goes to the brain at the level of a hypothalamus, and then from the hypothalamus, thyroid releasing hormone release, and under the then it effect over the pituitary gland, and from the pituitary gland, the stimulus goes in the form of a thyroid stimulating hormone to the pituitary gland. So this is access is very important. It's a vicious positive circle. Level 3 goes to hypothalamus, and hypothalamus send the thyroid releasing hormone, and thyroid releasing hormone will release the thyroid stimulating hormone. Uh, why the thyroid hormone is so important in the children? Everybody knows children's well-being and the growth is defined in the two terms. Number one is the developmental growth, and another thing is the physical growth. In the both point of views, it is very important. When the child grows, the brain needs thyroid hormone for the neurological development, especially the first 2 years of its life. We have seen a lot of cases. The child is the hypothyroid, and the basis is this one. There is some small amount of scanty amount of a tissue is there. With the passage of a time, this is, which is which will eventually burn out. If the small amount of a tissue is there, it spares the brain. But the height of that particular child, that mentally the child is smart, and but the height is very stunted. So, in the child, if the born with hypothyroidism, the child become a mental retarded. And this is the most commonest reversible cause of the mental retardation among the children. And as I have told you about the incidence in the Pakistan, every 1500 child, there's a one high incidence of one chance of there's a one child born with a hypothyroidism. So it is necessary to screen the every child at the time of a birth. Thyroid hormone begins to take shape at 7 weeks of gestation in the mother uterus, and the thyroid hormone is producing start at the 12th week of gestation. It means its functions start since then. The hypothyroidism in the children is defined as a thyroid dysfunction in the neonate, infant, and child, has a significant impact over the development. The goal of a treatment is to assure the normal growth, avoid the developmental delay. Now, first we will discuss about the hypothyroidism in a neonate. Neonatal hypothyroidism results from the decreased T4 production, which is called thyroxine proliferation in a newborn. It's the important preventable cause of a potential intellectual disability. It is an important cause of preventable mental retardation. T4 uh, is critical to the mineralization. Why it is so important? That basically the T4 is necessary for the mineralization of a central nervous system during the first 3 years after the birth, especially the first 2 years. Anybody have any idea about the mineralization? Mineralization means maturation of a nerve tissue. Without the mineralization, the nerve tissues is not becoming stabilized, and it cannot perform the 100% task. Hypothyroidism in a neonate, in a healthy term infant, the thyroid stimulating hormone concentration rise abruptly just after the birth within the 30 minutes to 60 minutes after the birth, 60 to 80. Instead of it should be in a normal range, it should be less than the 10 or less than the 10 in the first 28 days of a life, and less than the 6 after the infantile age group. Uh, Why this so high? Everybody knows that delivery is a difficult process. This is a transition phase, change of neonatal fetal physiology into the neonatal physiology. And just to bear the neonatal physiology, it is important, it is very important to give the strength to bear all these changes. For that purpose, the nature has triggered the things. It increases the TSH in the form of a cold surge because the baby was lie in a mother uterus in a warm environment. As the child born into the open environment, there's a sudden drop of temperature is there. Just to prevent the hypothermia, the nature has designed that immediately the cold response lead the stimulation of a TSH and trigger and hit to the thyroid gland just to increase the T4 and T3. Just to prevent, because the T4, T3 enhances the metabolism, generates the heat in this way just to prevent the heat, just to prevent the hypothermia in a newborn. This is the basis why there is an abruptly high level of a TSH in a newborn within 30 to 60 minutes. Then when the TSH concentration then becomes rapidly decreased by about the 20 the first day of a life as the you will provide the support, eventually it means there is no need to give this thing. Subsequently slowed down to 6 to 8 by the 1 week of life. This surge is got to stimulate the T4 secretion and it enhances the more T4 concentration in the serum of a newborn. Regarding about the pathogenesis and the pathophysiology of a hypothyroidism, we can understand it in this way. Okay, there are the different things. One is the anatomical problem, other is the inborn error of metabolism at the level of the hormones synthesization. First, we will discuss about the anatomically. If there is an absence of a thyroid gland, or it could be the thyroid is there, but it is not performing the function well. While all the thyroid hormone is there, hypothalamus is there, even pituitary gland is there, but and the hormone, the pathway to synthesize is not there. This is called the inborn error of thyroxine synthesis. This is the kind of the inborn error of metabolism, and the most of the thing here is a genetic cause. This is called the genetic congenital hypothyroidism. Best treatment cause of the congenital hypothyroidism is the transmission of the maternal antibodies which present in the mother and cross the placental barrier, come into the fetal side and impair the functions. And very rare cause is the central hypopituitarism. It is related with the hypothalamus. Some category which we have been observed as being a clinicians, there is a transient hypothyroidism is there for a time being, especially it present in the case of category of a preterm baby. And iodine deficiency is a part of Europe, but in our northern areas, it's also seen very, very high. After the campaign which was launched by the government, just to give the handi wala namak or namak, after that its incidence become a decrease. Autoimmune hypothyroidism, 1 in the 50,000, and in some region there is a incident accidentally give the high dose of iodine, just like in the case of the tumor and other things. In that cases, eventually the gland become a burnout and it can lead to hypothyroidism. So in short, it could be the thyroid dysgenesis, it could be the inborn error of metabolism, it could be the central cause, it could be the excess iodides, it could be autoimmune, and it could be the transmission of the maternal antibodies into the newborn. In all the form of hypothyroidism, hypothyroidism except the central level of a thyroidism, there is a serum T4 become a low and serum TSH is elevated. While in the case of the central hypothyroidism, you will get the report in a form of both the T4 and TSH low. Whenever you will come across with a low T4 with a TSH low and high index of suspicion of the hypothyroidism, I think about the central one. This is the feature. Hypothyroidism in unit. What features define the child looks pale, he has a protruded tongue. Overall, the facial appearance is just like a it is just like a coarse species. It's not a very delicate species. It's like coarse species. Broad nose, protruded tongue, some sort of double chin is there, and color is that yellow. This color, it could be the anemic or it could be the keratinism. More than the 95% of a newborn who have a congenital hypothyroidism have a little in a way of a clinical manifestation at birth. This is very important. Although the child have tendency towards the congenital hypothyroidism, but clinical manifestation at the birth are the very symptomatic symptoms are the very lesser in amount at the time of a birth. Because the sleep is the symptom, sleep is the normal pattern of a newborn. The child usually not pass the TD stool. It's a feature. It could be the feature of the hypothyroidism. Child has difficulty in her breathing. It could be the problem of hypothyroidism. Some maternal T4 crosses the placenta, and so the infants who cannot make any thyroid hormone still have some smaller amount of a T4 concentration at from 25 to 50% of the normal. Birth length, weight are within a normal range, but head circumference may be increased. This could be the alarming point. An open posterior fontanelle in a term baby is the sign of a congenital hypothyroidism. This is a very alarming thing. Okay, everybody should know if you will come across with the child with a broadly open posterior fontanelle, think about the congenital hypothyroidism. This is the lead, and this is kind of a sign. Other suicidal symptoms include the lethargic, hypotonia, hoarseness of the voice, hoarseness of the cry, the feeding problem, constipation, brachydactylia, umbilical hernia, dry skin, hypothermia, prolonged jaundice, and goiter is uncommon. Goiter is usually present in the cases of the inborn error of metabolism. Newborn who have congenital hypothyroidism, this generation may have a palpable goiter. Goiter is typically developed later in an untreated patient. In most of the time, it is not present at the time of birth, or the child is suffering from the hypothyroidism. When you will come across with the neonatal hypothyroidism, what tests is required? The test is screening include the TSH testing. Subclinical hypothyroidism is defined as a normal total or free T4 concentration and high TSH concentration. Then other step is first TSH is the screening, then the subclinical hypothyroidism is detectable by means of a free T4 concentration is low or normal or low or high TSH. It means that high TSH is a very important weightage in any case. The radio iodine scan of a thyroid are the recommended in the some expert as a part of initial evaluation. In Pakistan, usually we do the T4 and TSH, and radionucleoside. Usually the people from the Pediatric Endocrinology Society, they usually prefer it. And treatment is just only the levothyroxine. Is the oral drug of choice. Is recommended all over the world. It is like a medical medicine. When you start as soon as possible, when you detect it and start it, it prevents the intellectual loss. How we will follow these child in our clinic? By how we will do at the second or fourth week, initiate the T4 treatment. Every 1 to 2 months during the first 6 postnatal treatment. Then every monthly we will usually follow after 6 months. Why it is important? Just to monitor the metabolism just to monitor the growth of the brain, just to monitor the physical growth. Every then 3 to 4 months. And now after the 6 months, the follow-up become a spare apart. And after until the growth is completed, uh, 2 weeks after any change in the dose, it is necessary to call the child after 2 weeks when you will have increased the dose. The problem is this one, the newborns rapidly grow. There's a growth spurt, especially the first 3 months of life. When the child born, whatever the weight, child become a double at the 3 months of the age around, and then become a 3 times of the birth weight at the age of the 9 months. So the dose variation is very important. That's why it is more focused on the child every month, the first 6 months of the treatment, especially the postnatal period, and then every 4 months after every 3 to 4 months after the between the 6 and the 3 years of that age. After this one, after the 6 months, the growth spurt become a decline. Now we are talking about the childhood acquired hypothyroidism. It is childhood hypothyroidism most of the time, not in always, most of the time is acquired hypothyroidism. It usually occurs after the 6 months of the age. The hypothyroidism is caused by the failure of the hypothalamic pituitary and thyroid axis. The hypothyroidism may be the primary at the level of a thyroid gland, or it could be the secondary at the level of the pituitary gland, and it could be tertiary at the level of a hypothalamus. So whenever you will come across with the term the tertiary, it means the hypothalamus. Whenever you will come across with the term of secondary, it means the problem lies at the level of a pituitary. Whenever you will come across the level of the term primary, sorry, primary, it means the problem lies at the level of the thyroid gland. Now we are discussing about the underlying cause of acquired childhood hypothyroidism. In the primary, most commonest cause is the autoimmune, and we all have seen the very important thing. The autoimmune phenomena is more common in people who are suffering from some genetic disorder, especially the survival one is a Down and Turner's, and the post ablations, yes, it is by default some kind of surgery and anything, and it happened at the level of the neck. In that case, the thyroid is compromised like a surgically and the radioiodine therapy. And if some child has some kind of a malignancy at the level of a spine, has received radiation of a neck, in that case, the thyroid hormone will be the compromise. Besides this thing, certain medications which can lead to hypothyroidism, which include the thionamides. Other group is the lithium salt containing chemicals, anticonvulsants, amiodarone. Amiodarone comparatively more and anticonvulsants more used as compared to the other things. Iodine deficiency can also be the acquired form of childhood hypothyroidism. Iodine deficiency occurs at every level. Late onset of a congenital hypothyroidism means thyroid dysgenesis, and inborn error of hypothyroid metabolism can lead this thing. Now we will talk about the secondary hypothyroidism and tertiary. In the secondary, it usually occurs at the level of a pituitary in the case of the tumors which invade the pituitary gland. Some neurosurgery has been done for any purpose, cranial radiation and head trauma. Very miscellaneous cause, rare causes, thyroid hormone resistance development. What are the signs and symptoms of acquired hypothyroidism? इससे पहले जो पढ़ी थी हमने वो बात थी neonate की. Now we are talking about the childhood and acquired form है. उसके लिए तो fatigue, cold intolerance, somnolence, excessive sleepiness, Proximal muscles weakness, especially feel the child become a fatigue when the child become a fatigue when the child climbs the stairs. Delayed when you will come across with a neurological examination to check the reflexes of the child, you will find there is a delay in the relaxation phase of the ankle reflex. Usually, hypothyroidism picked up by means of a constipation and delayed growth. Overweight of a high weight overweight for the height. It means that when there is some kind of a malnutrition, the height and weight both become a decline, and height become a stunted and weight become a wasted. This is the case of a malnutrition. While in the case of the endocrine problem, especially the hypothyroidism, the height is declined and weight is the overweight according to that height. When you will come across with a child whose height is low but weight is more, think about the hypothyroidism. This is a remarkable difference. This child, when the child was a hypothyroid, there is a very poor species, or when the child recovered from it, the child developed a very delicate species. Hyperthyroidism in a newborn is a prolonged skin pores, thick skin, increase the body hair, enlargement of a gland, bradycardia, irregular. This is not a feature of a distinct delayed puberty, can occur in any childhood in a female child. This is the cycle and algorithm, how we index of suspicion nowadays. Whatever we have discuss. This is the nutshell of all the lecture. Then two tests are very important: free T4 and TSH. If the TSH and free T4 both are the low, think about the secondary hypopituitarism. Then the child needs a thyroid hormone stimulating test. And there is a no response or the thyroid hormone stimulating response, then it is called the secondary. If it is raised in the secondary hormone, it means the problem lie at the level of a pituitary is it hypothalamus. This is called a tertiary hypothyroidism. When both the low free T4 level and high TSH level, primary hypothyroidism is there. There is a fall in the linear growth, short stature, and bone age become a delay. This is called the hypothyroidism osteogenesis. And simultaneously, when we think about it is the kind of a primary hypothyroidism, it is also important just to evaluate in the case of the acquired form when the antibodies, because the thyroid said this is a very most important cause which can make the autoimmune hypothyroidism. Now regarding about the management, the childhood hypothyroidism is treated with a levothyroxine. न्यूबॉर्न के अंदर भी यही है, चाइल्डहुड में भी यही है, ठीक है। यहाँ पे गोल क्या होता है, वहाँ पे गोल है सब मेंटल रिटार्डेशन को बचाना एंड फिजिकल ग्रोथ करना। यहाँ पे जो सिम्टोमेटोलॉजी अपेयर हो गई है उन सबको ओवरकम करने के लिए रेगुलर उनको फॉलोअप करना और मॉनिटर करना फ्री T4 के लेवल को, TSH concentration को नॉर्मल विद इन नॉर्मल रेंज रखना। इट इज normal range means it should be the less than 6. Once the patient is become a euthyroid, many of the symptoms will be disappear. एक हमने जो पहले पिक्चर में देखा था कि जो बिल्कुल ब्लंट फीचर्स थे, तो इसके बाद आहिस्ता आहिस्ता होकर वो बिल्कुल डेलिकेट फीचर्स के वापस आ गए। दिस इज द acquired form of a hypothyroidism and this is the response of a hypothyroidism on the hypothyroidism. The prognosis of recovering the loss of the linear growth depend on the duration of the hypothyroidism as well as the age when the treatment is started. That's why it is very important, and every pediatrician and physician should well aware about the thing. If the child comes and when we will do the simple anthropometry measurement, we can screen the things. That's why it is so important in a pediatric clinic. The weight, height, and FOC is very important. Because if the weight is high and the height is the thing, is low, think about the hypopituitarism. And when there is a child born, come to you with a short stature,